Bali Airport considers monkeypox screening procedures. To assist stop the spread of monkeypox, screening procedures have been instituted at Bali Airport. Although the virus has not been found in Bali, officials are eager to take preventive measures to limit any possible spread as cases progressively rise throughout the world. Dr. Inomanjid Anum, the director of the Bali Provincial Health Office, told local media that his teams had cooperated with the Denpasar Class I Port Health Office and Agustin Girai International Airport on 6 August 2022. A consensus was reached during the conference regarding the significance of heightened screening procedures, and as a result, screening technologies have been installed to look for any potential instances of monkeypox that may be traveling to Bali. Included in these stepped-up safety precautions are temperature screening cameras, which may spot any rise in body temperature as travelers pass through the airport. The Denpasar Class IKKP and all airlines have collaborated with the Agustin Girai Airport's general manager, Handi Herdutiawan, and his staff to prevent the spread of the monkeypox virus. According to him, the globe is currently concerned about a number of health challenges, including monkeypox and foot and mouth disease. We do continue to work closely with relevant parties including the National Disaster Management Agency, BNPB, the Agricultural Quarantine Center, and the Port Health Office, KKP. The newly implemented screening procedures were described by Herdutiawan. In order to stop the spread of these diseases, he said that his teams are supporting facilities, such as installing thermal scanners at the entrance of arrivals and departures and putting disinfecting carpets at every entry and exit of the passenger area. The new screening procedures hardly affect how people go through Bali Airport. Herdutiawan reaffirmed that these preventive procedures are in place and that there are no particular guidelines or cautions regarding monkeypox. However, we continue to work to assure services so that passengers may fly securely and in good health, he said as he concluded his remarks. After a number of cases were discovered in nations where the illness is uncommon, airports all around the world boosted their scrutiny for suspected monkeypox cases. According to the World Health Organization, close contact with respiratory secretions, breath and saliva, as well as close touch with the infected skin lesions and blisters caused by the virus can spread monkeypox from human to human. Monkeypox symptoms typically take 6 to 13 days to manifest following infection. The first signs of the condition include a high temperature, a severe headache, swollen lymph nodes, and muscular pain. Blisters that resemble chickenpox will start to emerge on the face and progress to the body 1 to 3 days after the fever starts. 2 to 4 weeks may pass between symptoms. Although the infection is unpleasant and painful, nowadays it seldom results in death. Depending on how severe their symptoms are, some patients need to be hospitalized and quarantined. Australian airport officials will support enhanced safeguards at Bali Airport to stop the spread of foot and mouth disease. Authorities in Australia have expressed worry that the Indonesian government's reaction to the outbreak of foot and mouth disease has been a little slower than they had planned. A cheap yet efficient method of lowering the danger of foot and mouth disease crossing international borders is the installation of disinfection mats at Bali Airport. Animals with cloven feet, such as cows, pigs, goats, and sheep, are susceptible to the virus that causes foot and mouth disease. If the virus is discovered on Australian soil, it may cost the agriculture industry $80 billion in damages, according to Australian officials. It is advisable for travellers to either completely clean their shoes or leave them in Bali. Despite not being harmful to people, foot and mouth illness is very infectious, and people can spread the virus from one site to another by carrying contaminated dirt on their shoes, clothing, or baggage. The illness may endure without a living host for up to 6 months under the appropriate circumstances.